Welcome to the collaboration episode of the West Virginia Expanded School Mental Health Framework Series. In this video, we will take a closer look at how and why to effectively collaborate with your communities. We will discuss the core criteria of collaboration and link West Virginia grantees to specific stakeholder agencies. The West Virginia mini-webinar series covers 12 topics that will help schools and their partners gain a full understanding of the expanded school mental health model and prepare for implementation. This video is part of that series. I'm Tiffany Pittman, School Mental Health Coordinator from the Marshall University School Health Technical Assistance Center and the Division of Community Health within the School of Medicine. This video series is presented by Marshall University School Health Technical Assistance Center, Division of Community Health in the School of Medicine, with funding from the West Virginia Department of Human Services, Bureau for Behavioral Health. Our learning objectives are to increase understanding of how to form school-community collaboration that enhances student supports and to provide relevant resources. Let's do a quick review of the Expanded School Mental Health Framework. What is Expanded School Mental Health? ESMH is a collaborative, multi-tiered framework where schools, families, and community partners work together to improve student mental health supports. ESMH is designed to support all students in developing skills that support healthy coping and good mental health, addresses the critical link between academic success and mental health, is planned and proactive, not reactionary in nature. The framework is strengths-based, flexible, and utilizes data to build upon what is working in each school. Implementation is led by cross-systems leadership teams at the local and/or county level. Expanded school mental health can look different school to school due to the flexibility of the model, as long as the basic components of the framework are maintained. We'll discuss planning and other aspects of the framework with detail in other videos. This video will focus on collaboration. The purpose is to create a network of support that extends beyond the school while enhancing support within the classroom. We've all heard the African proverb, "It takes a village to raise a child." Collaboration between schools and the community is needed because raising and educating children is not solely the responsibility of schools, but a shared effort among the entire community. Children need a strong, supportive network of adults. Family members, teachers, mentors, and community members to provide safety, counsel, encouragement, and inspiration to navigate life successfully. Stable, responsive, mutually beneficial partnerships improve outcomes for youth, families, and communities. We often think of schools as the main place for addressing children's problems. The reality is that schools are a reflection of the community. They are neutral spaces where the diverse children of the community come together. Schools are not equipped to solve all the problems children face and may lack funding, personnel, expertise, authority, and the resources to do so. Schools must adhere to state policies, laws, and regulations. Collaboration can often make this more efficient. Collaboration between schools and the community is the epitome of the English proverb, "Many hands make light work." There are many ways schools and community can collaborate. Here are a few examples. Local nonprofits can partner with the school to identify children who could benefit from mentoring and provide some of those services at school. Social service agencies can establish offices in schools so families can meet their caseworkers and complete or update their applications for support. Primary care providers and schools can work together to offer a school-based health center or periodic screening events. Community mental health agencies can establish offices or visiting hours at schools to provide therapy and other mental health services to students. They can also offer staff training, student screening, mental health awareness events, and support to schools in the event of a student crisis. Community businesses and organizations can help fund special events or sponsor specific evidence-based programs. Blended, braided, and layered funding can result in a wider range of student support and more effective ways to meet student need. Schools can invite professionals from the community to provide academic enrichment activities. These may include career exploration, classroom lessons about specific skills, or student internships. What are the core criteria for effective collaboration? Well, start by identifying organizations, businesses, local government entities, nonprofit organizations, coalitions, and individuals in your community that might have an interest in supporting education. The list should include libraries, universities, museums, and community service organizations. Before contacting potential partners, it is important to clarify your objectives for the partnership. For example, you may aim to boost student achievement, enrich curriculum content, offer hands-on learning experiences, or enhance school facilities and resources. To ensure a partnership is sustainable, it should provide mutual benefits. It is important to recognize what potential partners can gain, such as favorable publicity, workforce development opportunities, or the chance to contribute to the community. Continuous communication is essential in nurturing a successful partnership. Set up a system for sharing updates and feedback, and think about scheduling regular meetings or check-ins. Engage as many stakeholders as you can in the partnership, including students, parents, teachers, school administrators. Gaining support from your school community will enhance success of the partnership. Create a memorandum of understanding or other formal agreement that clearly defines the responsibilities of each party to ensure clarity and avoid misunderstandings. Partners might require training or professional development to successfully engage in the educational process, such as gaining insight into the curriculum or incorporating real-world experiences into classroom instruction. Recognize and celebrate the achievements of your partnerships. This can be done by sharing stories in newsletters, on social media, or through local media outlets, as well as organizing events to commemorate the partnership, all of which highlight successful collaboration. Consistently assess the partnership to ensure it is achieving its goals. Depending on the nature of the partnership, this may include gathering data on student outcomes, conducting participant surveys, or organizing reflection meetings. Utilize this information to implement needed adjustments. From the beginning, think about ways to sustain or adapt the partnership for the long haul. This could involve diversifying funding sources, creating a succession plan for leadership positions, or establishing robust connections with various contacts within the partner organizations. There are many benefits of collaboration between schools and the community. Collaboration improves access to care, increases early identification of need, facilitates greater ability to meet a wider variety of identified student needs, and establishes crisis supports. By working together, teams can best use available resources, develop more effective and targeted solutions, and provide more comprehensive supports across the 3 tiers of the Expanded School Mental Health Framework. Community partners, including businesses, nonprofits, healthcare providers, universities, and government agencies, can offer resources, expertise, and real-world connections that schools might be unable to provide independently. Research consistently indicates that robust school-community partnerships have a positive effect on student academic performance, attendance, motivation, social-emotional growth, mental health, and physical well-being. Engaging families and the community can foster a more positive and inclusive school environment, where students and their families feel recognized and supported. Community involvement plays a significant role in enhancing parental engagement in their children's education. Findings from the National Center for Family and Community Connections with schools show that schools with high levels of community involvement experience greater parental engagement. Community partnerships in education also serve to stimulate local development. Schools can become central hubs for community activities, fostering engagement, unity, and shared responsibility. These collaborations can enhance the sense of community, and contribute to improve local infrastructure. In West Virginia, expanded school mental health grantees are required to collaborate with specific organizations and agencies in their region. The following is a list of required partners and the supports they offer. Prevention lead organizations can assist with obtaining and implementing evidence-based substance use prevention programs for schools. Regional intervention specialists provide suicide prevention, early intervention, postvention, and staff training. Regional Youth Service Centers coordinate community-based mental health services for youth and young adults ages 12 to 25 and partner with families and youth. These centers provide substance use treatment, including early detection and recovery support services and other types of mental health treatment and recovery well-being services. Comprehensive behavioral health centers offer a full range of mental health and substance use services, including psychiatric assessment and outpatient counseling. Children's Mobile Crisis Response and Stabilization Services teams have individuals with specialized training in de-escalation tools and knowledge of resources to assist individuals up to 21 years old in stabilizing the immediate situation. Regional Youth Transition Navigators connect youths and young adults age 14 to 25 who have mental health or substance use disorders with support to develop independent living and people skills, navigate systems like healthcare and education, and access to treatment and recovery services. West Virginia Family Resource Networks are organizations that respond to the needs and opportunities of the community. Partnering with community members and public and private organizations, West Virginia FRN members develop innovative projects and provide needed resources in their local areas. The West Virginia Expanded School Mental Health website at WV ESMH.org has many resources and tools for your convenience, including detailed information about our framework, a 10-step implementation guide, approved evidence-based programs per tier for grantees, an extensive resources page, and a news and event page where you can see highlights from ESMH and AWARE grant sites as well as upcoming trainings. We encourage you to check out all of our videos on the Marshall University's School Health Technical Assistance Center's YouTube channel. Check out our other videos in this series where we explore different components of the West Virginia Expanded School Mental Health Framework. Thanks for joining us for the collaboration video of the West Virginia Expanded School Mental Health Framework.